Healthcare in China. One of the biggest concerns of people moving to China is the level of healthcare accessible should they become ill or seriously injured. Major cities like Beijing, Shanghai and Guangzhou now have modern medical facilities, with well-educated doctors using modern equipment. Regulatory changes have opened the field for private medicine and dental care in China. Local hospitals have imported more medical equipment, and some specialty clinics in the larger cities have care equal to their counterparts elsewhere in the world. Medical clinics, hospitals and emergency service. There are three types of medical facilities that are available in China. The first is a foreign-managed facility with expatriate and local physicians. The second is local hospitals that have special units for foreigners and VIPs. The third is a standard local hospital. Some standard local hospitals have specialties. For example, most cities have hospitals solely dedicated to the care of children. Foreign-managed hospitals. Foreign-managed facilities adhere to global standards, offering medical care that is on par with what would be offered in a developed country. Most of their physicians are foreign or Chinese who have practiced medicine overseas and returned. The nurses and administrative staff are local. The clinics may lack some of the laboratory facilities, equipment and emergency capability of their international counterparts. If this is the case, they typically rely upon labs in Hong Kong to do analysis and feedback results. They also rely on relationships with local hospitals to access equipment and emergency services that they don't have in their own facilities. The advantage of a foreign-managed facility is that you can trust the doctors speak your language, are educated in healthcare in a standard that you are accustomed to, and have the experience required to be properly licensed. They also have pharmacies attached that offer internationally manufactured medicines that align with your home country prescriptions. Foreigner units of local hospitals. Several local hospitals have foreigners or VIP units that offer higher standards than normal Chinese hospitals and have local staff that are English-speaking. These hospitals can vary widely in how well they meet foreigners' expectations for sanitation and healthcare standards. Payment policies are different than the foreign-managed hospitals. You may be required to pay a deposit of at least $1,300 just to be admitted. Still, the cost of an examination in a local hospital's foreigner unit is less than $50, usually at least half that of the foreign-managed hospitals. Cultural differences toward healthcare can also create stress when a foreigner is being cared for in a Chinese hospital. Chinese people are usually passive participants in healthcare and faithfully follow doctors' orders. Chinese doctors unaccustomed to foreigners may find the questions, discussion and talkativeness of Western patients unsettling. A foreign patient must be persistent and tactful to get the information needed to feel comfortable. It may also be difficult to secure medical charts when leaving the hospital. Do not assume medical records will be provided. If you need them for your home physician to review, it is best to be proactive in securing them. Chinese approach to medical practices also differ from those in the West in that Chinese prefer aggressive treatment. It is standard to put someone feeling under the weather straight onto an IV drip. Antibiotics are often given for just a common cold. Local hospital staff in a local hospital rarely speak English, so foreigners who use them must speak Mandarin or bring a friend to translate. Local hospitals are for the masses. In going to them, you will experience long lines, bureaucratic processes and no say over which doctor you'll see or when it happens. There are few private wards and if admitted for an overnight stay, you will be put into a room full of people with similar health issues. There are also usually no support facilities for family or friends to stay with you. Although some people have received quality care in these kinds of facilities, the U.S. consulate cautions that there is more than anecdotal evidence that foreign residents regularly encounter medical care quality problems in China. The one advantage to a truly local hospital is the cost. A district hospital charges about $1, a better hospital double that. Other health concerns before coming to China. You should check with your doctor to understand your country's immunization recommendations for China. At a minimum, you should be current with courses of diphtheria and tetanus, hepatitis A, hepatitis B, Japanese B encephalitis and polio. The major health issue encountered by expatriates in China is food poisoning. Although food preparation standards are improving in major cities, the sanitary condition of Chinese kitchens and hygienic training of its staff is dismal by global standards. Unless you are at a trusted restaurant, it is best to assure that all vegetables and meats are well cooked, to drink boiled water or open bottled water yourself and to avoid eating the rinds or skins of fruit. Given the prevalence of hepatitis and China's rapid spread of AIDS, it is important to practice safe sex. Awareness is still low as to how these diseases are spread among the bulk of the population.